Dr. Tembo.
Yes.
I'm so happy and privileged to be with you today.
Thank you.
And thank you for introducing me to this wonderful source of water.
Yes.
This is so marvelous. I would like to know a few things from you.
Yes.
Yeah. How many households are benefiting from this source of water?
Just like I said, over 5,000 households.
5,000 households.
Yes, are benefiting from this source of water. It is the only beacon of hope. People come down from the hills to come and benefit.
Apart from the families,
yes.
Are there some institutions around which also benefit from this source of water?
Yes, there are institutions that would benefit from this source of water. First of all, we have the Medical Center 3, Chiswamba Medical Center 3, with the maternity wing where mothers deliver from.
Okay.
This would be a beacon of hope if water reaches them.
Okay.
We have the primary school with over 1,000 pupils.
Over 1,000?
Yes, they spend long hours without water, you can imagine, including adolescent girls that are undergoing menstruation. Then we have the secondary school besides us and several. So there are also churches around us that will benefit from this borehole if we implement the smart solar water systems.
Okay, Dr. Tembo, you have mentioned the smart solar system.
Yeah.
Before we go that side,
yes.
Would you take us through a few challenges which the community is facing, and as far as the water scarcity is concerned?
Thank you so much. Children spent long hours here. Children and women spent long hours here.
Yes, I can
They
see a few of them.
To school. Some of them leave as far as 8 p.m., 9, 10 p.m. in the night. They don't
9 p.m. in the night.
Yes,
okay.
They don't get time to read their books in the night. Our girls are raped along the way as they go back to school, as they go back home.
Okay.
And of course, women suffer at the medical center because imagine having a medical center 3 and a maternity wing with no water.
Yes, Dr. Tembo, in your own view,
yes,
would you suggest some solutions?
Yeah, before I suggest solutions, children at the school, pupils spent long hours without water. You can imagine. This is a dry area. Children spend long hours without water, including teenage girls who undergo menstruation. So the hygiene issues is really down. So we have lots of waterborne diseases that are affecting this community. Now, when it comes to the best solution for this community or for this water crisis, the best solution I think about here is we need to employ smart solar water systems, where we are going to install a solar system here that will be now, the solar system will be pumping the pump, will provide electricity to the pump, and then this pump pumps water now to the hill where we have the water reservoir tanks. These water reservoir tanks would now supply to different homesteads. We would have community taps so that people, instead of coming here, maybe we count 1, 2, 3, maybe 100 homesteads, we give them 2, 3 taps and they keep there. And then that would solve overcrowding here, it would solve delays here, it would solve a lot of challenges, including...
Dr. Tembo,
yes.
Another question I have for you is,
okay,
why do you think, therefore, this project should be a priority now?
Thank you so much. This place should be a priority. This project should be a priority because, number one, we have registered unwanted, unintended teenage pregnancies. This community registers the highest teenage pregnancies. We have school dropouts because kids are raped out along the way. We have registered the waterborne diseases, including cholera. So I feel like we need to prioritize this project as soon as yesterday to have smart water systems where people can access water through the taps, and then we can, have an improved livelihood among these people.
Yeah, another one, actually the last one, I'm sorry I've asked you a lot, but how much do you think will be required to have the installation of the solar, connecting the taps, having a reservoir for the water? Yes,
yeah,
how much?
This project can even go as far as $35,000.
Okay.
Because it will involve buying strong solar water systems. It will be set here the strong pump, pipes, the reservoir tanks, and then start supplying to different villages.
Okay, thank you so much. Thank you so much, Mr. Tembo.
Right.
We will be getting in touch with you. Our viewers, I think it gives sense in the project how colleague has just described. When this water is pumped and distributed to different families, it will translate into one comfort. People will receive water at the right time and actually utilize it for different purposes, be it irrigation, home-based activities, and I think also the health will have to improve in this village. This community will be a model community, and I hope this intervention is a better one, making it a priority. And for our viewers, we cannot do it without you. So we seek for your collaboration to provide this community with safe, clean water.
I'm Kasese District, senior woman in Kasese SDA Primary School. At school here, I will have some challenges. Some of the challenges are brought by lack of access. At school here, even the community, we lack access to water. So, at school here, sometimes we face problems pertaining girls.
Yes, you have said there are some problems that concern girls, and this is the main purpose. We would like actually to capture this information. What are these challenges are girls facing?
They face challenges of not having enough water here at school. And the water that we get access to is very dirty and it is very far. The pupils miss some lessons because of fetching water.
Okay. Thank you so much for this information. We are sorry we are not capturing all that you would like to give us, but we have understood there's a challenge. So we thank you so much, and we are going to ask you to give us a few of the girls around, especially maybe even a boy, to also elaborate on the same. Thank you so much.
But sir, before you elaborate so much, I wanted to request you.
Please come on.
Yes, I want to request. I request you that if you have any means to help us, here our girls sometimes they drop out from school due to such challenges. They can come with the 2 pads, but they don't wash.
Oh.
Because there is no water.
Okay.
And even the pads they don't have. Some girls don't have pads. They use local materials. So I request that if you can have access to some sanitary pads, you can help us. Because we heard that there are some pads which are made locally. So you can help us to have some sanitary pads to help our girls here at school.
Thank you so much,
and even you give us a washroom.
Thank you. Oh, you also need a washroom.
Yes.
Okay. Madam, thank you so much. We will have much of the information documented. Rest assured that we shall get back to you in a while. Thank you so much.
Thank you, sir.
Dear viewers, after talking to the senior woman, I have Dr. Tembo with me. Yes, doctor, what do you have on the same topic?
Thank you so much for this opportunity. I wouldn't want to speak very much. Allow me to ask Kabuo to tell us the challenges they are facing as pupils of this school of Kitswamba as far as water is concerned. Kabuo, what challenges are you facing in this school?
Our school, we have no water. Okay. I spent long hours without drinking.
Yes. We also hear from Johnson. Johnson, how are you?
I'm fine.
So which challenges do you guys have here at school? I see you were an energetic boy. What challenges do you have?
So the challenge I will go and tell you is about water. Who has no water? So for us as children, we like playing more.
So what happens when you're playing more?
We play more. After playing, we come and look for water. As we reach water, is be little. That's why you tell you we lack water.
Okay. But they play when they grow thirsty, they don't get any water to drink. I have another girl called Joy Kabuo. Kabuo, tell us about the challenges you're facing here as girls.
Our school has no water. When I go in menstruation, I cannot clean myself.
Yeah, you see. So,
sorry about that.
sorry about that. And let us hear from Joycelyn. Joycelyn, what challenges are you facing here?
For us, we have dirty toilets and smelling toilets, so we don't have water to clean them.
Yeah. So issues of hygiene
sorry about that.
Are very paramount here.
Okay, having heard from these brilliant children, smart, lovely, they look nice. So, doctor, in your view, what should be done?
Thank you so much. Because we have very many dropouts. This school has over 2,000 pupils, but they are dropping out because some of them during the session they cannot access water and they drop out. Have unwanted pregnancies. Some of the kids, because they will trek long distances, they are raped. So the biggest challenge, the solution we need is reaching water to this place. And because we have a valley that has water, we need water pumped. And then once that water is pumped on the reservoir tank on the hill here, then the children in this school can access water. Otherwise, you can see their lips are dry. Their lips are dry, their feet are dirty because they don't have access to water. Children, am I lying? No. Yeah, so these kids need water more than yesterday. Over to you.
Okay, thank you so much, doctor. We will take the concern to take this information to reach out to the rest of the communities. So, people, how are you? You're fine. Yes. I have heard that some of you don't drink water. Is it true? Yes. I have heard that some of you, when you go home, you go very far to fetch water. Is it true?
Yes.
Is it true that some of you sleep when you have not bathed?
Yes.
Someone sleeps when you have not bathed. In the bed you sleep. Is there anyone who has got that as a problem? Yes, no, yes, no. Dear viewers, this is the population, a few of them. The others are playing, others are in class. For Rwenzori Community Development Network, I'm Mundia Kurunjimudisha, capturing this story. I would like to assure you that it would be nice if you reached here and see the same. But because you are far away, I take this opportunity to bring this story to you. And I would like to say, we cannot do it alone. We ask for your assistance. We ask for your intervention. We ask for your involvement. And all these, a few who are here, and others who are in the villages there, will appreciate your contribution. And I pray that you afford and support Rwenzori Community Development Network. Support them, have access to quality education, have access to clean water, and to enable them have a life worth living. Thank you so much, and bye for now. Friends, goodbye.